Has your doctor ever told you that you have stage 3 kidney disease and your mind stopped processing after they said stage? Or maybe you've looked at your patient portal and saw stage 2, 3, 4 and thought, what actually does that mean? Am I going to need dialysis? Can I fix my kidneys? If you've ever asked those questions, you're in the right place. Because today I'm breaking down the 5 stages of kidney disease in plain English. By the end of this video, you should know what your stage means, what your numbers mean, and most importantly, what you can do to protect your kidneys. Hey friends, I'm Erica, the neighborhood NP. I'm a family nurse practitioner specializing in nephrology. And every single day, I take care of people with kidney disease. From the patients that just found a little protein in their urine, all the way through dialysis and transplant. My goal is simple. I want you to understand your body well enough that when you walk into the doctor's office, you feel confident asking questions instead of feeling overwhelmed. Now, before we jump in, I do need to give a quick disclaimer. This video is for education only. It is not personal medical advice. It is not personal medical advice. Please don't hear me say, oh, Erica on YouTube told me to drink 60 ounces of water. Some of my patients have congestive heart failure. Some have liver disease. Some are on fluid restrictions. Every person is different. Think of this video as a roadmap. It gives you foundational knowledge so you can have a better conversation with your own healthcare provider. And if you find this video helpful at any point, please do me a favor and hit the subscribe button. It tells YouTube that the information matters, and it helps me keep making free educational videos that help people understand kidney disease without all the fancy medical jargon. Before we talk about stages, I always tell my patients something that I think gives them hope. There are many different causes of kidney disease, and some are completely out of your control. Some people inherit kidney disease. Some people develop kidney disease from autoimmune disorders like lupus. Some are even born with structural kidney problems. None of those are your fault. But then there are the things that we can control. Blood pressure, blood sugar, smoking, certain medications, repeated kidney stones. And those are the things that I spend my days helping people manage. Because while I can't promise that we can reverse kidney damage that's already happened, many times we can slow it down, and sometimes dramatically. That's good news. The biggest thing I coach my patients on are controlling blood pressure, controlling blood sugar if you have diabetes, avoiding diabetes if they don't, avoiding NSAIDs such as ibuprofen, Advil, or naproxen unless specifically advised by your doctor, staying hydrated if they don't have a fluid restriction, maintaining a healthy weight, exercising, and keeping follow-up appointments. These aren't glamorous, but boring habits save kidneys. So how do we actually decide what stage you're in? We mainly use 2 tests. The first is your eGFR, and that is estimated glomerular filtration rate. Think of it like your kidneys report card. It estimates how well your kidneys are filtering toxins from your blood. Generally speaking, higher numbers are better, and lower numbers mean your kidneys are not filtering as well. The second test is a urine test, and that particular test is called urine albumin to creatinine ratio, or for short, uACR. This tells us whether protein is leaking into your urine. Healthy kidneys are really like good coffee filters. They keep protein where it belongs, and that's in your bloodstream. When protein starts showing in your urine, that's often a sign that the kidney filter is becoming damaged. And here's something important. We can't diagnose kidney disease from one bad lab. These changes need to be present for at least 3 months before we call it chronic kidney disease. Stage 1 means your eGFR is 90 or above. Most people hear that and think, so my kidneys are normal. Not exactly. Your filtration number is good, but there is evidence of kidney damage. Maybe protein in the urine, cysts, or changes seen in imaging. The good news, most people don't have symptoms. This is a golden opportunity. When we find kidney disease this early, controlling blood pressure, blood sugar, and treating the underlying cause can make a huge difference. Stage 2 means your GFR is between 60 and 89. Again, at this stage, most people feel perfectly normal. Patients tell me all the time, but I don't feel sick. And that's exactly why kidney disease is so sneaky. You can lose kidney disease long before you ever feel different. This is why routine lab work matters so much. Quick timeout. If this video has helped you understand your kidneys even just a little bit better, I'd love for you to subscribe. And if you're someone living with kidney disease or the caregiver of someone with kidney disease, I created a resource called 100 Kidney Disease Questions and Answers, and I'll make sure to leave the link in the description below. Now let's keep going. This is where many people first hear the words, you have chronic kidney disease. Stage 3A is an eGFR of 45 to 59. Stage 3B is between 30 and 44. Now here's something I really want you to hear. Stage 3 is not a death sentence. I've taken care of patients that stayed 3A, 3B, 4, and sometimes even 5 for years. They travel, they enjoy retirement, they enjoy the grandkids. They live full lives. Why, you ask? Because they focused on the things that they could control. So I don't want you to hear the word stage 3 and think dialysis next week, because that's simply just not how this works for most people. Some patients start feeling tired, some notice swelling, others develop anemia or changes in their lab work with their electrolytes, and when I say electrolytes, I mean sodium, potassium. But this is often the stage where good treatment can keep you from progressing towards dialysis. Let me give you another example. Maybe you're someone who gets kidney stones often. Most people think of kidney stones as just incredibly painful. And trust me, they are, or so I've heard. But they can also cause damage to the kidneys. If the stone blocks the tube draining the kidney, then urine begins to back up towards the kidneys, and then pressure builds. Repeated episodes can injure the kidney over time. Here's my favorite clinic question. Do you know what else uric acid causes? Gout. That's right. The same uric acid crystals that can settle in your big toe joint and make it hurt so badly that you don't want to get out of the bed can also contribute to a certain type of kidney stone, different location, but same crystal problem. Stage 4 means your eGFR is 15 to 29. And now we're talking about significantly decreased kidney function. This is when we start planning, not panicking. We talk about dialysis options, transplant options, protecting your heart, managing anemia, meeting with a renal dietitian, because the goal is to be prepared, not surprised. Stage 5 means that your kidneys are functioning at less than 15%. At this point is when it is very close to needing dialysis to be able to help clear the extra fluid that your body is accumulating, as well as remove the waste that is building up in your system. At this point, many patients are on the road to dialysis or transplant sooner than later. But here's something I tell my patients all the time. Your choices still matter. And honestly, no matter what the numbers look like when you're in my clinic, if you are not feeling horrible, then we wait till you feel it. And they always come and let us know when it's time. Because we never want it to be our choice. We always want it to be the patient's choice, whether they're ready to start. In fact, I saw a patient about 14 days ago, and today I needed to prepare her to get a hemodialysis catheter placed so that she could start emergent dialysis in the next few days. And that is how horrible she felt. And she was so sad and so defeated, had a good support system with her. I had saw them the last time. And you know, I gave her a hug and a pep talk, like, you're gonna feel so much better. This is not the end of your life, right? You still get to carry on and see your loved ones. Just because you're on dialysis doesn't mean that you can't go on vacation. We have patients all the time that'll be like, hey, I'm going to Florida with my family. Can you call down there and schedule dialysis? They get down there, they go to dialysis, they're 3 days in the morning, and then they're on the beach enjoying their family for the rest of the time. However, by the time we make it to stage 5, we definitely have to have some things in order, because the worst thing, well, maybe not the worst, but pretty close to the worst thing, is getting a hemodialysis catheter placed in your upper chest, because That catheter is going directly into your heart, and it proves to increase your risk of infection. So ideally, we would like to start a patient with a graft, and those grafts or fistulas take about 6 weeks to mature. So now you see why it's so important to start a little bit early to prevent having to start emergently through a HD catheter. But off my little tangent, your choices matter. So you still have to show up for your treatments, you still have to follow the care plan, take your medications, watch your fluid intake in between dialysis sessions. Those things absolutely affect the quality of life that you have after starting dialysis. And most of all, I want you to know that it is never too late to make changes. Even small little tweaks to what you're doing now can prolong that kidney health for even that much longer. One last thing, I mentioned uACR, which stands for urine albumin to creatinine ratio, and that's something you need to know about as well. Protein in the urine matters. 2 people can both have stage 2 kidney disease. One has almost no protein in the urine, and the other has a very large amount. Even though they're technically at the same stage, the patient with the higher amount of protein in their urine is at a much higher risk of progression of the disease. That's why the urine test is just as important as your blood work. If there's one thing that I hope you remember after this video, it's this: a kidney disease stage is information. It doesn't have to be your future. It tells us where you are today so that we can make the best plan moving forward. I've cared for patients that have stayed in the same stage for many years, because they focused on what they could control. Could your kidney disease progress? Yeah, it could. Can we often slow that progression? Absolutely. So learn your numbers, know your blood pressure, know your urine protein, know your medications, and partner with your healthcare team. If today's video helped you better understand kidney disease, please do me a favor and hit the subscribe button. Give this video a thumbs up, and leave me a comment telling me what stage you're in if you feel comfortable. Or simply tell me something that you learned today. I read the comments, and they help me create videos that answer your biggest questions. And don't forget to grab my ebook, 100 Questions and Answers on Chronic Kidney Disease, linked in the description below. It's the resource I wish every kidney patient had after leaving the nephrology office the first time. Thank you so much for spending your time with me today. I'm Erica, the neighborhood NP, and until next time, keep learning, keep asking questions, and keep taking care of those kidneys.